This is Average Joe BT. In this episode, Scully and I, we're going to talk about knee trauma. Everything football, car accidents, falling in general can mess up this knee. That's what we're going to talk about, so I better buckle up and stay tuned. Now, when Scully and I talk about knee pain and trauma, we're talking about that hard-hitting stuff. Man, you get into a football game and you just smack that knee to the side, you can go ahead and kiss those ligaments goodbye. Because more than likely you're going to have what's called a happy triad. And what's a happy triad? Well, it's not so happy. That's where you tear the inside ligament here, which is called the medial collateral ligament, or the MCL. You normally tear the ACL, which we've all heard about before. That's the anterior cruciate ligament, which really keeps that knee stable. And then we tear the meniscus. Those three things get damaged when you get hit from the side like that in a football. Oof, that's killer. Same thing, baseball. Let's go ahead and you're playing that and you go ahead and pivot and turn. You can tear these beautiful little blue meniscus right here. And once you tear that, more than likely you're gonna have to have surgery. Now, when you go ahead and just fall down the stairs, you can go ahead and tear anything up there. You can fracture a kneecap, you can dislocate the kneecap, you can fracture your femur bone, you can fracture your tibia. Anytime that something that gets thrown at you and it hits your shin, that can mess up and fracture your tibia or your shin bone or your fibula, that tiny little bone off to the side. Now, the interesting point that y'all might know about, if you fracture your fibula bone, a lot of times you can be weight bearing as tolerated, which means you can continue to walk without having to be on crutches or anything. But if you break your thigh or femur bone or your tibia bone, you're going to have some weight bearing restrictions for quite a while. So I want you to stay tuned for more information. Now, the muscles of the knee are quite interesting, aren't they, Scully?
Boy, I wish I had some muscles and some legs.
You don't have a body or anything, so you're going to have to sit this one out. Anyways, now those muscles of the knee, quadriceps, really that just is Latin for four. It's four muscles that run all the way down your thigh and attach different parts of the knee. Now they basically extend your knee out or straighten your leg out. And all the muscles on the other side basically bend the knee or flex the knee this way. So it's an interesting, nice design on both sides. So one does one thing and one does the opposite. Now when you fall or you get hit in or a car accident or anything like that, not only do you traumatize the bones, you also traumatize the muscles. You can tear those muscles, you can get nerve damage, swelling, inflammation, all that stuff starts to occur when we have trauma to this joint, or I should say any joint in the body, but specifically the knee. Now I have all kinds of treatment techniques, all types of ways to reduce that knee pain, right up in that link right there, or right there. One of those two spots. And after this video, go ahead and click on that. All types of treatment techniques to reduce your pain in the home. But in this episode, we're going to talk a little bit about what happens in a car accident. Now, this happens rarely now because the glove box and your whole dashboard doesn't really collapse on your body like they used to. But let's just say you're driving about 65, 70 miles an hour down that road and all of a sudden you get a sudden stop. Now, what happens there is your body has to keep on moving. You don't think about that. Car's going 65, your body's also going 65 miles an hour, and when that car makes an immediate stop, your body needs to stop also. Well, a lot of times that happens is hopefully the seatbelt is clicked and it's in spot, but if it's not, and that knee hits that dashboard, what happens is this part of the knee gets stuck on the dashboard and this top part of the knee keeps going forwards. And when that happens, you actually rupture your PCL or posterior cruciate ligament. Now the ACL we talked about last time with that football or baseball, but that posterior cruciate ligament, can get damaged also. And that's really the way that it gets damaged the most. You could also hyperextend it in that one video I just showed you with the baseball guy where his knee just what we call hyperextended or snapped right back. That could really damage not only the muscles and tendons, but also that ligament right there in that back. Zoom it right up there for you folks. If you have any questions, positive or negative, Scully and I are always here to go ahead and field those. Love to have you subscribe. All right, I want you to stay tuned for a little more information. Squatting, kneeling, all these different activities really puts a lot of stress on that knee joint. So I really want you to think about that when you're doing certain activities around your house. I'm going to throw that link up there again. I want you all to look at that. I want you to hit the bell. We'd love to have you, Scully and I. We're going to try and bring video a couple times a week. Okay, and until next time, Scully and I always like to say look up and keep smiling. See you next time, folks.